If you are a patient in my hair loss clinic, which is something I specialize in within dermatology, the first question I'm going to ask you, besides how are you thinning or are you shedding? Hair loss does not mean the same thing to everyone, and understanding the pattern of your hair loss is essential to picking the appropriate intervention. Also, if you want to learn more about hair loss and how to treat it, make sure you're following. Shedding is exactly what it sounds like. You're noticing more hairs coming out in the shower. When you brush your hair, you're walking around your home and you're seeing stray hairs on the floor. That is atypical for you. That is shedding, compared to thinning, which is you may not notice any additional hairs coming out, but when you look in the mirror, you notice, oh, I can see more of my scalp. Or when you go to put your hair in a ponytail, you can wrap the elastic around more times than you used to. If you have thinning with minimal shedding, which is actually the most common pattern of hair loss that I'll see in my hair loss clinic, that is something that is usually slowly progressive over your lifetime. It is a chronic hair loss condition. So for example, male and female pattern hair loss fall into this category. Because these are long-term hair loss conditions, they require, if you so choose to pursue treatment, long-term treatment, because if you were to at some point stop your treatment, your hair would go back to what it would have been if you had never been on treatment in the first place. However, if you have shedding, that is usually due to a stressor on your body, and once that stressor is dealt with, that shedding typically is going to stop, and you don't need any long-term hair loss interventions to treat it. So whether that's something like childbirth, work stress, a medication side effect, losing weight, once your weight stabilizes, once you come off of that problematic medication, once you've had your baby, once you've dealt with your work stress, that hair shedding will slowly come to a stop, and then your hair will grow back. You do not have a long-term hair loss condition. Now, I assume you came across this video because you are dealing with hair loss, so are you thinning or are you shedding?